Quick legal disclaimer, all information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider. Welcome to Jaw Talk with Dr. Tiffany. I am your host of this new podcast, and this is episode number 1. For those of you who don't know me, I have dual degrees in dentistry and physical therapy, and I'm passionate about all things jaw joint related. The other word for it is TMJ. Does your jaw work right? Can you open and close? Can you eat, speak, do all of those things without pain or difficulty? One of the reasons that I wanted to start this podcast was over the years, again, more women than men have really suffered from jaw joint problems or TMJ. And I think that clients really just feel frustrated because they want to know, where do I go? Who's an expert? What's the right pathway to treatment? And it's not always clear. And I think from a provider standpoint, there's also been a lot of confusion because there's differences of opinions of how to treat this. And what I want to do is really just bring you the most evidence-based, up-to-date information about jaw joint issues. And as a dentist, I've had lots of dentists tell me, I don't really understand that much about the jaw. So can you help me with this? So again, this podcast is for both patients and providers to provide the latest information about TMJ, TMD, and how we can work together to really collaborate and build a community for both patients and providers. In the future, each episode will be about a topic related to TMJ or TMD. There may be some question and answers from my community. There may be times where I'm bringing on other experts, other dentists, orthodontists, myofunctional therapists, all of those fun people. I want to really highlight both TMJ, TMD, as well as myofunctional therapy and Airway world. I know that in dentistry, Airway has become the hot topic, and the paradigm is really shifting to where we're airway aware, airway centric. And I think that if we're going to be looking at airway and doing things like appliances or surgeries or orthodontic care, we really have to not leave the jaw joints behind. So that's another goal of this podcast, is to really bring awareness to the TMJ, which are the joints, which everyone has a left and a right TMJ. So TMJ really just refers to the joints that move your lower jaw or your mandible. So when you say I have TMJ, yeah, everybody has TMJ. You have a left one and a right one. But in the medical community, we use the term TMD, or temporomandibular joint disorder, or TMJD, to kind of refer to more of like the laundry list of symptoms. So that could be clicking and popping with your jaw joint. It could be headaches. It could be limited range of motion with your jaw. And so when I say TMD, that just means that broader picture. Okay, so when I say TMD, I'm referring to all things jaw joint related. So that could be issues opening and closing your jaw, could be clicking and popping, it could be headaches, it could be neck pain, shoulder pain. I really want to just kind of apply that term TMD as more of like that global problem that people experience. And so what do you do about it and how do you treat it? Who's the best person? So I really feel like I'm kind of a bridge provider because I have both a degree in dentistry and a degree in physical therapy. I really try to bring together those professions to really like make it best for the patient. And so one of the things that I created was TMD Collective as a space to guide, educate, and create community for people that have had issues with their jaw and really don't know where to go. I created TMD Collective because in order to make it better for the individual, we have to make it better for the collective. And I can tell you the collective is not happy because 10 million people globally suffer from TMJ disorders. This is a space where you can get information, listen to experts, and create a community of support. So I grew up in a small town over in Eastern Washington. My dad was a dentist, and of course I had orthodontic care when I was about 12. And in those days, I had headgear, which is like this big metal thing that shoved my maxilla or my upper jaw back to try to get my lower jaw to come forward. And that's what we did. And, back in those days, you would extract permanent teeth and then try to fit all the teeth together. So dentists have always been really focused on the teeth and how they fit together, or what they call the bite or the occlusion. Well, now, as we're starting to realize more about airway, we realize that, hey, we need more room. We don't want to cram all the teeth together, because what that does is it constricts and limits the airway space. And then we have adults in their 30s, 40s, 50s that start developing issues like sleep apnea or upper airway resistance syndrome or sleep disordered breathing. And so really that's what we're seeing in dentistry and medicine, is a shift when we're talking about airway. And what I want to highlight is the temporomandibular joints, or TMJ, and make sure that they don't get left out of the picture. I want to talk about the jaw joints in a way that is an orthopedic perspective that really doesn't leave that out when we're talking about what treatments we need to do to improve airway. So I wanted to take a little bit of time to just tell you my journey of how I got here with both my dual degrees of physical therapy. So as a physical therapist first, I went to Loma Linda University, practiced therapy, and then I moved back down to California and I decided, I think I'm going to go to dental school. So again, also at Loma Linda University. And what I noticed when I was in dental school is that there was just really not very much discussion about the TMJ or the jaw joints. We learned a lot about drilling on teeth, carrying around our little typodonts, and how the teeth fit together. We learned a lot about occlusion, or the bite, or how the jaw fit together, but we really didn't understand a lot of the principles of the joint and why people ended up with problems with their jaw joint. So I remember feeling a little bit frustrated in dental school, like we just didn't get enough information about that topic. And so after dental school, one of the things that I did is I really wanted to get more continuing education. And in about 2012, I went to a meeting in San Francisco with the California Dental Association, and I heard two speakers speak. One was Dr. Mark Piper, the other was Dr. Jim McKee. And I just felt riveted by the principles that they were discussing in this. And that was really about how we need to look at the jaw joints from a different perspective. We need to look at it from an orthopedic perspective. So if you think about your knee joint, if you injured your knee, let's say you were skiing, you had a big crash, what you would do is you would get x-rays and you'd get an MRI, and from that point, then you'd decide whether you wanted to have physical therapy and a brace, or if you needed arthroscopic surgery on your knee. And that's pretty standard in our healthcare system. Well, I feel like when it comes to the TM joints, we just really don't treat the joints the same way. We say, here, we're going to try physical therapy, or we're going to try appliance, or we're going to do orthodontic care, we're going to move the teeth, or we're going to adjust the bite. And no one's ever really looked at the TM joints from an orthopedic perspective. So that's one of the things that I want to discuss, is why are we not looking at the TM joints from an orthopedic perspective? And what I really advocate for with my patients is really getting all of the information up front. And that can mean getting a cone beam CT scan, which is going to look at the hard tissue of the skeleton in 3 dimensions, and also an MRI, which is going to show the articular disc. It's going to show the soft tissue of the joint. It's really going to give us an information and give us the best treatment protocols of how to go about that. So that's what I really want to advocate for with TMD Collective, is really getting that imaging up front for our patients and really understanding what's going on with joint and why we're seeing all of this laundry list of symptoms in the beginning. So then it takes all the mystery out of treating our patients. I want to preach is just the fact that healthcare has been dominated by a patriarchal society, and women definitely have more issues with like ligament laxity, jaw joint problems, and that this contributes to all of those TMD disorders. And so we need to be empowered to speak our truth and really advocate for ourselves in this kind of situation. I think when we think of the TM joints from a different perspective, we have to have a flexible mindset, and we really have to collaborate with both our dental and medical professionals so that we really give the best outcome to our clients and our patients. So one of the things that I'm doing here in the Greater Seattle Tacoma area is I'm a general dentist that's limited my practice just to treating jaw joint problems, or TMD. And so I'm partnering with some different dentists in this area. So if you'd like to be seen as a patient, you can check out my website, www.tmdcollective.com. I have links there where if you want to schedule an appointment at a particular location, I have online scheduling and cloud-based patient database. I also offer therapeutic Botox injections for both jaw joint problems and cosmetic, and you're able to schedule from that. You can also follow me along on Instagram at @tmd.collective.